So now we're gonna tour sick bay. It's huge. He's got lots of files in here, lots of places to put patients. Let's take a look.
No problem. So,
Hi.
sick bay on any cutter has to be locked. Because when we come in, we have everything to treat a patient with, but I also have their personal information locked up as well. So everything locked up. This is all medical records, so it's people's PII or personal identifiable information. I'm a custodian of it, so anything that has to do with a patient's history or medical goes in here. Every time they're seen, a note gets written and put in there as well. Whenever they come in to get seen, they hang out. This is our exam table, all of our lights and things. We have medical equipment and medical gear we use to treat and heal. We have everything up top in the cabinets, medications in the back drawers. All our vitals machines are hanging on the bulkhead, so that would be blood pressure, pulse, temperature. Up top are all meds, on the bottom are all meds. The fridge is all of our test equipment here, and locked in our safe, we do carry and we are authorized to carry narcotic medications, such as Percocet, Valium, and Vicodin. We carry that locked up, and the XO is the only one with the code to it. So we can treat large and mass pain if we have to. Patient gets to hang out here. I get the cool desk. All the references that we use and read through for any type of patient interaction, if we're worried or we don't know what it is, we can look it up. We pretty much have 27 to 35 different references at a given point in time. The bottom is all the logs and things that we have to keep as corpsmen on the boat, from water to patients to pharmacy to meds to anything and everything. And then of course we have the computer and printer. Thankfully we have a printer on this boat because, again, with PII I can't be printing it to a different office. I want to have it in one set spot that comes out, I pull it off, sign it, and file it right in the med record. And if you move back further, the thing about bigger cutters like this is it has a quarantine area. We have 2 racks back here for quarantine or for stability. So if we had a patient with a large traumatic injury or large wait time before a medevac, we can put them in here. Of course, clean it up a little bit. We just happen to be in port right now, so
that's where we're keeping our snacks.
Yeah, that's where I'm keeping everything. We have a cabinet over here as kind of our backup storage area. Add additional stuff that we don't have room for over in the cabinets. Mainly this is orthopedic, so I got braces and stuff on top, and then IV supplies in the middle. The cool thing about this cutter is has its own head. So back in when this cutter came out in the 60s and 70s, they used to actually run orthopedic full physical therapy, things like that. So they actually have a shower and tub in here, and then they got a sink and toilet. So now it's just storage because we're not actually hooked up to water anymore and make it work, but it's a lot of stuff in here. We could physically stay in here and never have to leave as corpsmen. So because I'm one person on a cutter that's 378 foot long with over 100 people, people have to take care of themselves if there's a major injury. So we have these bags over the boat. They're called gun bags. Now, traditionally, they've only been at fire crews or fire teams, but anybody on the boat's trained to use it. There's 20 articles in here, 20 different items that people are trained to use and can use in the event of an emergency. Gunshot wounds, broken bones, abdominal wounds, head wounds, things like that, it's all in here. During any type of emergency on the boat, whether it be fire, flooding, structural damage, things like that, the mess deck becomes what is called BDS, which is Battle Dressing Station. Now, all the tables that you see have covers, everything's kind of locked up in cabinets, but this all opens up. And we have medical supplies to treat anything and everything we would need. This is mainly dressings and cleaning wounds. So we got trauma dressings. These are all elastic bandages. These are all triage tags, scissors, things you might need for closing up a wound. All of our splints and oxygen bags. So these are splints. That's actually mash trousers, BDS roll, and oxygen bag. So up here is all of our IVs and sterilization. So these are sterile gloves for sutures. These are different airways. This is IV sets, more IV solution and things like that. The bottom section here is collars, big trauma dressings, medical pads, burn kits, so anything we would use to splint a neck and treat high degree burns and things like that. So
So we can't wear covers on the mess deck because
It's
we have a...
It's tradition. So if for any reason there's an emergency on the boat, the mess deck becomes a surgical suite, and it's a sign of respect to those who are fallen and missing. BDS, we actually take these covers off the table, and there's usually slide locks that slide up, and these become our treatment areas. People lay on them and we fix them. For anybody that has passed or has died, this is where they are at, and it happens. So we don't wear covers for that respect. Along with all the other tables on the mess deck, this one's designed for surgery. You can pull people off, but it also has surgical lights that move and angle. These yellow ones are battle lanterns. They're designed if power goes out and these don't work, these lights do. So they're on their own battery operated switch.